Once this has been well diagnosed, then your doctor will typically give you several things to help treat it, including prescription strength anti-inflammatory ointments, the use of a very significant heel lift, often attached to the bottom of the shoe to allow that heel to tilt forward and make that back of the heel less prominent. In addition to the use of that heel lift, he or she will also recommend physical therapy to allow for strengthening of the Achilles, and then doing some types of local treatments to the back of the heel to reduce the swelling around that prominence. Once the treatments have been tried, and if they're ineffective, then the final stage of treatment for a haglund's deformity can be surgery. And what I usually recommend for this is at least between 3 and 6 months of treatment with non-surgical means before deciding on surgery. Once these other things have been effectively used and failed, then it's appropriate for an operation. And when surgery is recommended, your doctor will typically recommend removing surgically part of that bump, which usually requires removal of that top corner of the bone, and in some instances, a surgery on the Achilles tendon may be a portion of that procedure if the tendon has tendinitis or has started to break down a small amount. In particular, if the x-ray shows calcium developing like a spur in your Achilles tendon, then that will also need to be removed as part of that surgery. These surgeries can be very effective, but the recovery can range quite from a relatively short period of time to a very long recovery. If only the bone is taken care of, then sometimes a 6-week recovery process may be all that's required.